Thank you everyone for coming to Project Echo Care of Older Adults. So my name is Pam Yankee Love, and I'm the Director of Research and Evaluation at the University of Louisville Traeger Institute, which is partnering with the Kentucky Coalition for Healthy Communities, as Justin indicated. And we're glad you're here. So just some technology tips. We do ask that if you have the capacity to go on and turn on your camera, it just helps to go on and create a learning environment. If you can go on and do that, we could get to know one another. Go on and check to see if your mic is working. And then we ask that you go on and mute yourself until you have a question or a comment that you'd like to share with the group. You can always use the chat for questions and comments as well. We also are always looking at that. There's ways to check your microphone and your video, kind of the way that Justin just went through with one of our guest speaker today. So if you actually get kicked off, you can always call us back and we'll get you back into the meeting. Thank you. All righty. So I was wondering if, as I said, this is a collaboration between KCHC and the Traeger Institute. So I was wondering, did Mona or Barbara want to talk through the mission of KCHC?
Sure.
Thanks, Barbara.
Yeah, so thank you, everyone. My name is Barbara Gordon. I'm the Director of Community Engagement at the Traeger Institute, and just want to share a little bit with you about the Kentucky Coalition for Healthy Communities. This is a statewide coalition, and it's somewhat of a coalition of coalitions. In other words, we work with local coalitions and organizations for the sole purpose of creating community support systems for older adults. And we also work towards helping to develop the workforce through training opportunities such as Project Echo, as well as many other opportunities. We want to develop the workforce and concerned community members, older adults, caregivers, et cetera, to empower communities to become healthier. Thank you for being here.
Thank you so much, Barbara. And for those of you guys who aren't familiar with the Project Echo platform, it was created by an MD, Sanjeev Arora. He's a hepatitis C expert, and he created Project Echo as a telementoring, telementoring program. And the idea is to move knowledge and not patients, and to build capacity at a local level. He basically noticed that patients were coming 200 to 300 miles away, and he just didn't feel like he was moving that knowledge out to those communities and those healthcare professionals at a local level. So he developed this platform, and there's a kind of a rhythm to a Project Echo, in the sense that there is a didactic, then there's a presentation of a case, and then we work together in our learning community, trying to design what the recommendations might be for that particular case, in the hope of being able to take the information that we learn from the didactic and incorporate it in, looking for best practices in interdisciplinary team care. So we add that if you have yet to go on and type your name and your organization in the chat, we ask that you do that at this time. It helps us get to know one another, and it also helps us to get to see who is in the meeting. So if you can do that, that would be great. Thank you, everyone. I see you doing that. And if you have yet to go on and put your name under your video square, that's always a helpful way of us to get to know one another too. The way you can do that is in the upper right-hand corner of your video square. There are 3 little dots, and you go on and click on those dots, and it'll say the drop-down menu will come, and it'll say rename, and you can rename and type in your name, your pronouns, your organization, all those types of things. That would be very helpful. And alrighty, I'm going to update mine just to model. We do provide an attendance certificate to anyone who is interested. All we ask is that you go in and complete the short survey at the end that Justin or myself will introduce you to, and we'll make sure to get that certificate of attendance to you. All right, we are so lucky to have Sheldon Haden with us from the Kentucky Elderlaw PLLC, and we're going to be talking about what is elder law. And this is actually this is our February Project Echo, building on our January Project Echo, where we began talking about advanced care planning. Justin actually led us last month through the high game, and we were able to experience and begin to think about advanced care planning. And we're going to follow up on that to learn a little bit more about all of the things that are elder law related and what is all involved in there. And we're so lucky to have Sheldon here with us today. Sheldon is an attorney at the Kentucky Elderlaw PLLC. She also volunteers as a supervising attorney at the Traeger Institute Brandeis Elder Law Clinic. So prior to joining the Kentucky Elder Law, Ms. Haden was a trial attorney with an emphasis on medical malpractice, nursing home, and product liability. She worked on the defense side of that litigation for 10 years at Stites and Harbison, PLLC, before spending the next 5 years on the plaintiff side with Ann Oldfather at the Oldfather Law Firm. Afterwards, she served as the chairperson of the medical review panels in Kentucky before joining the Kentucky Court of Appeals as a staff attorney. And Ms. Haden earned her law degree from the University of Louisville, Louis D. Brandeis School of Law in 2001. And Sheldon, would you like me to tell about Kentucky Elder Law, or I didn't want to steal your thunder if you wanted to go on and do that?
I can go ahead and do that. Thank you. And I am so sorry I cannot get my video camera to work. We actually had an unforeseen circumstance happen at our office yesterday. We had a client come in. He was brought in by his brother, an elderly gentleman. And after they left, the brother called to tell us that he discovered his brother had bed bugs. And we went into our office and there were bed bugs all over our conference room. So our office is being fumigated today, and I'm working from home with my laptop computer that I don't normally use. So I cannot get my video to work. So I'm sorry about that. But yes, elder law. So we as elder law attorneys, it's not the same as estate planning. It is different. And if you'll go to the next slide, I'll just go ahead and start talking about this. Estate planners, they usually look to preserve assets from taxes or do some long-term planning to get your plans in place for the future. As an elder law attorney, I am mainly looking to preserve assets from nursing home costs. We also do all those good estate planning things as well, but a lot of our clients are elderly and they have reached a point in their lives where they're going to need some kind of assistance to do those activities of daily living. And they want to know, do we have to sell mom's house for her to go to a nursing home? Because a nursing home costs about $10,000 a month right now in Louisville. And even if you have a $100,000 house, that will only give you 10 months of nursing home care. So as an elder law attorney, people come to me to see if we can try to preserve some assets, get qualified for Medicaid, which is the biggest payer of nursing home cost, and save some of those assets for the family. So we also do Medicaid and veterans benefits issues, and that's a lot of what my practice is. Now, turning to the next slide. What we do at the Traeger Brandeis Elder Law Clinic, which is actually located there at the Traeger Institute for the Aging, and our clinic is in the basement, is we have law students from the law school who volunteer as part of their classwork to meet with clients and draft documents. And there are 4 basic legal documents that everybody needs, but most of us don't get them until there's a crisis in our lives or we've gone through a bad experience with one of our own loved ones. But those 4 documents are a durable power of attorney stating who's able to handle your financial affairs. An up-to-date will or a last will and testament that's saying who gets my stuff when I die. Your living will, which is also known as advance directive, and that specifies your end-of-life decisions. And then the healthcare surrogate, it's also known as a medical power of attorney in some states. And that's somebody who can make decisions for you medically if you're not able to communicate. And those are the 4 documents we do at the Traeger Brandeis Elder Law Clinic. We do those free of charge for clients who qualify. And it's a great service that we've been doing now. This is our 3rd semester doing it. So just to let you all know about that. If you all have any clients who may need legal documents, it's a great service. So why do documents matter? If you don't have the right documents in place with the right language, you may not be able to do some of the financial planning you want to do in case of a crisis. So, and it also avoids guardianship, which I will talk about a little bit later. But guardianship is where you actually have to go to court. There is a trial and it takes away your rights, and the state can become your guardian, or sometimes a friend or family member can be. But having documents in place just simplifies things for after you're gone. So when should documents be done? They should be done now. You can't predict what will happen in the future. There could be a car accident, you could have a stroke, a heart attack. Just have something that makes you lose your capacity to execute legal documents. So we always tell people to go ahead and get their documents now. You can always update them or change them later, but it's better to have those in place should something bad happen. And I have 3 teenagers right now. I have twins who are 17, and I've already told them before they go off to college, they're at least doing a power of attorney and a healthcare surrogate, so that if something happens to them while they're away at college, I will have some kind of documentation so that I can talk to their doctors, so that I could talk to the bank, you know, and make decisions for them. So let's talk about the first document, and that is the durable power of attorney. This is a document that allows somebody to handle your financial affairs, to sign your name to contracts. You're able to keep your rights, but but it also names somebody who can do those things for you. It's durable because that means it stays in effect even if you're incompetent. And it becomes effective immediately when it's signed. Sometimes people in my office have clients who come in and they bring in a power of attorney that's called a springing power of attorney. And that means it doesn't spring into place until a doctor says that the person is incompetent or incapacitated. We always recommend people do an immediately effective power of attorney, because sometimes you cannot get the doctor to sign to say the person is incompetent, or they don't want to offer that kind of proof. So we always do a durable power of attorney that's effective immediately. And your power of attorney does end when you die or when you sign a written revocation. So I always tell people, if at a certain time somebody that you've named as your power of attorney you do not trust, then you just need to revoke that in writing and name somebody else. Now, as far as the power of attorney goes, we always recommend that you name at least one person to be your attorney in fact or power of attorney, and also to name a backup. So a lot of times I'll deal with couples and they'll name each other as their power of attorney, and that's fine and good, but it's always good to have a backup. And I sometimes recommend somebody a generation down, because you might do your legal documents and then not do them for another 10 or 15, 20 years. Plus, if something ever happens to your spouse or significant other, you want to have that backup person. We do record the original power of attorney in the deed room if somebody owns real estate in a county. That just allows your power of attorney to deal with real estate if they ever need to do that. And it does need to be notarized. So I often get a question that I'm married, do I still need a power of attorney? Yes, you do. Most people have some sort of individual asset that does not have their spouse's name on it, like your IRA or a life insurance policy. For me, I have a spouse, and I know I can't call the water company without him being on the phone because our water bill is in his name. So we say that you need a power of attorney even if you are married. The next document I'm going to talk about is the living will, which is also called an advance directive. Most of my clients know about this document because every time they go to the hospital for some kind of procedure, the hospital will say, do you have a living will, or would you like to put one on file? This is a simple form that actually sprung out of several cases, but some that everybody remembers. This is the Terry Schiavo case. It was a young woman in Florida. She was 26. She had a cardiac arrest, and they were able to bring her back, but she had significant brain damage due to loss of oxygen. Her husband wanted to remove her life support, but her parents stepped in and said no. And it went up and down the courts. It got the president involved. It was a long legal battle. But after that case, most states started instituting these living wills, and they're a form that just says, if I no longer have decisional capacity, or I have a terminal condition, or I'm permanently unconscious, what are my wishes? Do I want to be kept alive on machines, or do I want to be able to die naturally with just the administration of pain medicine? So in this living will, you get to make those decisions. And so clients, they will say whether they want to be kept alive on breathing machines. The second question is feeding tube and artificial hydration. And then the third question that is part of our living will in Kentucky is whether you would like to be an organ and tissue donor. So for the next slide. Can we switch to the next slide? Oh, okay. Yes. Okay, so living will versus a do not resuscitate, or a DNR. A lot of clients are very confused by this. They think they're one and the same. In the medical community, you all probably know the DNR is a medical document. A living will is a legal document. And so I tell people, I do not do DNRs. I cannot do your DNR. A DNR is after your heart has stopped. So you have technically died. A living will is while you're living. And so that is the difference between the living will and the DNR. The healthcare surrogate document. This is the third document, and this is also known as a medical power of attorney. We just call it a healthcare surrogate in Kentucky. And that's someone who can make healthcare decisions for you only if you cannot communicate those wishes yourself. So the difference between this document and a power of attorney is financial, and we also recommend it's effective immediately. Your healthcare surrogate is medical, but it also doesn't spring into place until you cannot communicate with your doctors. So this is a good document to have if you're unconscious or unable to talk to your doctors. But this names somebody to be your healthcare surrogate who can talk to your doctors, access your medical records, consent to treatment, get a second opinion. It includes a HIPAA release. And it's important to have this on file with your doctors and hospitals so that there's no barrier to being able to communicate about a loved one's medical treatment. So the fourth and final document that I'll talk about is the last will and testament. So it's very confusing, living will versus last will and testament, but they're different things. The three documents I've talked about, the power of attorney, healthcare surrogate, and living will, those are documents that control while you're alive. This document controls after you die. And most people are familiar with a will, but this just says who gets to get your things when you've died. There's certain assets that are controlled by the will and certain assets that are not controlled by your will. If you have a life insurance policy with a beneficiary designated, that life insurance policy will not go through your will. It'll go straight to that beneficiary. The same thing with a POD or TOD, that's a payable on death or transfer on death. If you have those designations on like a bank account or an IRA or 401k, those will pass directly to that person you've named and not go through your estate. The things that go through your estate are things that just have a title of that person. So if my mom were to pass away and the house was only in her name, the only way that I could get the title to that house transferred to my name would be going through probate court and getting appointed to be the executor of her will and having the title to that house transferred to me if I was named as the person. As an only child, I hope I am, but I don't know. And then if you do not have a will, though, people say, well, what happens if I don't have a will? Then your things are just going to pass according to Kentucky intestacy law. And that just means that they'll pass according to what the law has said are your closest relatives. And so it will be your spouse or your children or your parents or your siblings on down the line. For a valid will, there are 2 witnesses that need to sign, and there is a notary recommendation. You don't have to have your will notarized, but it makes it much easier as an attorney to prove that your will is valid if it is notarized. So for your will, if you're going to leave everything to your spouse, is that a good idea? Yeah, that's fine if you're both young and healthy. But as an elder law attorney, I always tell people that it's not a good idea if you have a spouse who might need nursing home care in the future. And again, that goes into the difference between an estate planning lawyer versus an elder lawyer. And so sometimes people get very offended at, I'm going to not leave everything to my husband. Well, if your husband is in a nursing home and if you predecease him, then everything you've just left him will be going to the nursing home. So I always tell people, if you are in need of long-term care with a nursing home, it's always best to consult with an elder law attorney to see what makes sense as far as your legal documents. So those are the 4 legal documents that we do at the Traeger Elder Law Clinic and that we offer for free for qualifying clients. But I did want to touch base on just a couple more things and then I'll wrap up. And the next slide is trust. Sometimes people say, oh, do I need a trust? There are 3 types of trust. There is the revocable trust, an irrevocable trust, and then special needs trust. Revocable trust just means you can revoke it. You can take it away during your lifetime. And then the irrevocable means that you cannot revoke it. And you've named somebody else to be the trustee of your trust. What is the difference? I use revocable trust when I'm dealing with blended families. So, you know, it's second marriages and mom has 2 kids from her first marriage. Dad has 2 kids from his first marriage, but now they're married and they want to leave everything to their 4 kids collectively. But the danger is if you both have a will and you both of your wills say, I leave everything to our 4 kids equally. Well, one of you is going to die first. And there's nothing to prevent that second surviving spouse to change their will to say, nope, I'm going to leave everything to my 2 kids, not to all the 4 kids. So in that case, I recommend doing revocable trust for those families because it locks it in place until the second spouse dies, until the survivor dies. Then the irrevocable trust is what I use as an elder law attorney. And that is an irrevocable trust that you put your assets in, and it starts a 5-year look back clock. And that's a very important time frame as an elder law attorney for Medicaid purposes, because Medicaid will look back 5 years to see what assets you've transferred outside of your name to make yourself poor or less than $2,000 in accountable resources so you could qualify for Medicaid. So what I use an irrevocable trust for is to put people's assets in that irrevocable trust, start their 5-year clock running. And that way, if they ever do need nursing home care, then they could go to the nursing home and say, listen, I don't have anything. And they're like, oh, well, don't you have a trust? Yeah, but it's irrevocable. I can't access it. And then they'll say, okay, you have less than $2,000 and you qualify for Medicaid. So that is one of the legal entities that I create for families who want to have to preserve their assets for the future in case they need nursing home care. Then the 3rd type of trust is a special needs trust. It can also be called a supplemental needs trust. And that is so disabled beneficiaries do not lose their benefits. And this is a really important document that you need if you have clients who might be getting governmental benefits, like you have a grown adult with Down syndrome. Well, they're probably getting a lot of good governmental benefits through their disability. And if they were to inherit $100,000, that's going to throw them off of those benefits until they spend down that $100,000. But if you were to leave it to their trust, their special needs trust, then they could hold that $100,000 in the trust. it could be used to benefit them still, but not disqualify them from their benefits. And so there would be a trustee who could say what the money could be spent on that wouldn't disqualify them from their benefits. So that's the 3 types of trust that we do. And the other thing that I wanted to talk about was guardianship. And that's what happens if you do not have any kind of documents in place. If you have a good power of attorney, you might never need guardianship. But if you don't have a power of attorney, if you don't have a healthcare surrogate document, then there might come a point in time where you might need to get guardianship over someone, or someone might need to become guardian over you. Lots of people learned about guardianship and conservatorship because of the Britney Spears case. Britney Spears's father became the conservator of her money, and people were outraged. They were like, how can a grown adult have somebody being in control of their money? And that is because her father went to the court and said she does not have the capacity to handle her own financial affairs, and he was appointed conservator. But then she was able to get that revoked. But there was probably a good reason that the court made the father the conservator of her money. It is sort of unusual. Usually guardianship in Kentucky is we see guardianship and conservatorship together, because if somebody is in a state where they can't control their finances, they're probably in a state where they can't control their healthcare needs. And then if you'll skip through that slide and just go to the next one, this is the last slide I have about probate. And that is just the court that you go through when you have a loved one who passes away and you need to deal with all of those assets that they have. So again, if you have a will or if you don't have a will, you will go through probate court, and that will decide who is the executor of your estate. That person has to gather up all your assets, pay your debts, and then distribute your assets according to either Kentucky law or according to your will. And that is the last slide that I had.
Thank you so much, Sheldon. We do have a few minutes for questions. And I'll start with one that was in the chat. I don't know if you saw it. Amara asked, what if you have no living relatives and no will?
So everybody has relatives. It's going to either be, it'll be like long lost cousins. And so if you don't have a will, and the court will appoint a public administrator to find your closest relative, and then the assets will pass to that closest relative.
Okay, and then Lily followed up, is there a minimum age to go and get help with these things?
At the Traeger Institute, no. I mean, you have to be 18 to sign legal documents. So you have to be over 18 or over to sign legal documents, because it is a contract.
Okay. And one thing that I've heard, and I'm glad that you clarified that when you were talking about the difference between a will, an estate will, and a living will. Many people don't understand the difference. So if you ask them if they have a living will, they'll refer to their estate will and not realize that they do two completely different functions. So I'm assuming you spend a lot of time doing that kind of education.
Yeah. So it's very confusing. I wish Kentucky called living will an advance directive instead of a living will, but they call it a living will, and it gets very confusing. Also, people get very confused about the difference between a living will and the DNR, like I talked about. And then also there's the MOST document that I'm sure many of you all are familiar with, which is the medical order of scope of treatment, I think, MOST. But that is a document that they're using in the healthcare field about how you want your end of life to go. And people get confused on whether that's a legal document, which it's not. So I always refer people back to their doctors if they do have like a terminal condition where they need to, and they want to have their wishes spelled out. I tell them to go consult with their doctor about the DNR and the MOST document. But the living will is it's a simple form, and it only asks a few questions, but I get the most thoughts from clients about that, because it's those situations of, well, if I am brain dead, do I want to be kept alive? And everybody wants to add like parameters to it. Like, oh, I had a cousin who was on a ventilator for 7 days, but then they came off, you know, or I had a relative who they said was brain dead, but then there was brain activity all of a sudden. So they want to add parameters to it. But the Kentucky legislature has given us just a form, and it is yes or no. And that's all I can tell people to do. You can name a person to make those decisions for you. You can just designate somebody to make those decisions for you if that situation arises. And you can do that. But I always tell people that the whole purpose of the living will is to take that burden off your loved ones. I mean, if you have somebody who's been in a severe car crash and the doctors say they're brain dead, and then, you know, you're going to turn to the loved ones and say, do you want to keep them on a machine or not? And so they're dealing with all that grief and crisis, and then they have to make a major decision like that. So it's always good if you have a living will, so at least you can point to that document to say, no, she said she would never want to live like this, or no, she said, keep me alive on it. I trust that medical science is going to catch up and improve me, you know?
So there's one more question for like a qualifying question, and then we're going to have to move on to the to our case study. But Jim asks, you mentioned that the services at the Elderlaw Clinic are available for people who qualify. What does it take to qualify?
Yeah, so right now, I mean, we're just saying underrepresented population. We haven't put any kind of like dollar figure on it. So far the Traeger Elderlaw Clinic, we've been servicing most people who come in. We've only turned down one client, and that was because they owned a house in Germany. They owned a house here. They owned several properties, and their estate was worth $10 million. And I told them that I cannot draft a will for someone with an estate that large because there will be tax consequences, and these law students do not know enough about that. So we still drafted a power of attorney and a healthcare surrogate document for that couple, but I did have to turn them away from drafting a will for them because of the tax consequences. But as long as they're a patient who you feel would not be able to afford an attorney on their own, or wouldn't know how to get to an attorney, then I'm having the law students go ahead and draft documents for those people. It's really good experience for the law students to actually meet with real clients and actually draft real documents that are going to be used. And I want to serve as many people as we can, but I just don't want people who could afford an attorney, you know, just abusing the service.
Yeah. Thank you so much for your presentation. We're now going to transition to our today's case study. So thank you so much, Sheldon. Sam, are you available to take recommendations?
I am indeed. I'm here.
Okay, thank you. So Carrie, I am going to transition to your slides. So you can review your slides, and at the bottom of your slides, I'll advance, but if you ever need me to back up, please speak up.
Okay, thank you. Also, if I sneeze, I'm sorry. I just started sneezing for no reason. So the case today, I don't have like the full information on him because there was some scheduling things that happened last week where I couldn't interview him. So this is based off of what I know from him, like from our one meeting. So the patient was referred to Traeger for therapy due to depression. But when I met with him, he told me that what matters most to him is that he needs legal and financial assistance because he was involved in a 15-year legal dispute over property that he owned. And it ended up with him losing his land and all of his money. So it's kind of hard to address his emotional needs because we have to focus on the financial needs first and getting him in a stable situation. So my questions that I wanted us to think about during the presentation are there any legal options for the patient at this point? And what are recommendations for assisting the patient in moving on from his legal difficulties? So he's a 61-year-old male. He was diagnosed with depression, and he also told me he has, I think it was degenerative disc disease, but I don't have access to his medical chart because his doctor that he goes to for primary care is not with Traeger, and I don't have that information at this time. So there could be more health conditions. And I don't know any of his clinical measures because of that, but he told me that the last time he saw his primary care doctor a couple months ago, she told him he was in perfect health. So I guess that's good. So for background information, the only significant symptoms that he described to me were some back pain and weakness due to the degenerative disc disease in his spine. So he has some limited mobility, and it sometimes impacts what he's able to do around the house too. But he eats fruits and vegetables all the time, and he tries to eat good meals, but he told me that he also has periods of time where he goes through not feeling hungry or not having the urge to make meals for himself. For social history, he dropped out of high school, and then he got a GED and tried to go to college, but he dropped out of that as well. But he describes himself as autodidactic, and that he has taught himself a lot of different things. So he loves to learn. He just prefers to teach himself from the internet and from books that he finds instead of going to traditional school. And he currently does not have an advance directive or a power of attorney. And that is something that I wanted to address with him, but he's basically like, what is there to protect, because I don't have anything left to protect. And so he doesn't have transportation. He walks everywhere or takes the bus. As far as I know, he's living for free in a friend's apartment or home. I don't know the full circumstances of that because he didn't describe all of it, but he does have a place to live currently that is, it sounds like it's stable. And he enjoys hiking and walking, so that gets him plenty of exercise. And the lack of transportation doesn't really bother him because he would probably walk everywhere anyways. But he is very concerned about his financial problems, and that is his biggest focus at the moment. When I met with him in our intake, he scored a 9 on the PHQ-9, but then he didn't feel like talking about it with me, which is fair. But he does report that he's been in therapy in the past and he's had mixed results. And he's self-diagnosed himself with PTSD after his court experiences. He said it was very traumatic to have to go to the court and then explain his case and then fight them with appeals and all the problems of going back and digging everything up again. So he said that was a very painful experience for him. And it ultimately ended with him losing this property that he owned and all of his financial security trying to pay for the lawsuit. And the patient does live alone. And when I asked, he wasn't able to identify any family members or friends that he could rely on for support, but he does have the friend that lets him stay in that apartment for free. And he said that he is friendly with people and there are people he talks to regularly. He just doesn't believe that he could ask them for assistance, which makes me feel like he's just reluctant to reach out for help from people. And for individual health behaviors, he recently quit tobacco products and has been using the nicotine chewing gum to help with this, which he said has been very helpful so far. And now he's just kind of worried about what happens when he has to quit the chewing gum. And he exercises regularly, but he said if the weather is bad and he's not feeling energy, then he won't go out to walk. But if it's just the weather, that's not going to stop him. And he does comply with his medications, but he has trouble reminding himself to eat when he's not hungry. And he told me he drinks exactly 3 ounces of alcohol every night, no more, no less. So he has access to all the health services except for dental care. And when I asked him about that, he said he hadn't been to the dentist in over a decade and that he hasn't needed to go because he doesn't have cavities. And at the time, I didn't have enough time to give him education on the importance of dental health care. So that's on my list of things to talk about with him. But he is satisfied with his physical health at the moment. So in the home, all of his environmental needs are met, but the fact that he doesn't own his home is worrisome. And he says he has no fall hazards and he's able to take care of himself and do all the personal hygiene tasks. But sometimes he does have difficulty motivating himself because of his depression. The patient has a primary care physician that is not located at Traeger, and he has a good relationship with her. But right now, there's not anybody else that I know of that's involved in his care. But I am working on getting him referred for chronic care management to get him some financial assistance and other resources. And I see Danielle's question about his income. I don't know his income because I didn't get a chance to ask him, but I know that he told me he has no money right now. Like he said that all of his money went into this lawsuit and it was in the property that he lost. And so he said he has no savings at the moment. And he's also not working currently. As far as he told me that he worked as a as a carpenter for a while, but because of his back pain, he hasn't been able to do that. And so he hasn't been working. I don't know where he's getting financial resources at the moment because I haven't had a chance to ask him. And I didn't have access to his medication because he doesn't share his chart through Epic, and I didn't have a chance to ask him because we got rescheduled. So I do know that he takes medication for going to sleep at night that was prescribed to him, but I don't know what it is or the dosage. So to remind you again of the questions, are there any legal options for the patient at this point? And what are some recommendations for assisting the patient and moving on from his legal difficulties? And if you need me to try to clarify anything else, I can try.
Thank you so much, Carrie. So I am going to stop sharing my screen, and I'm hoping that we can all work together and come up with some good discussion to help Carrie support this client.
Danielle, he's 61.
So Carrie, have you talked to him about the Elderlaw clinic, or is it after hearing Sheldon's presentation, does that seem like something that would be supportive to him?
I did briefly mention it to him and he sounded interested, but he was also, because I had talked to him about the power of attorney and a living will when we did the intake, but he had said something along the lines of like, there's nothing I have right now that needs to be protected. So he was kind of interested, but he also was like, I've already done all this legal stuff for 15 years. I don't know what else people could do to help me at this point. But maybe if somebody from the Elderlaw clinic wanted to meet with him and kind of hear his story, because he tried to explain all of the legal documents to me, but I don't have a background in that, so I didn't understand it all.
Yeah, and Carrie, this is Sheldon. I mean, we would be happy to meet with him and at least listen to what he has to say legally. Sounds like the case is already wrapped up, and obviously it wasn't a good outcome for him. But everybody always says, I don't have anything. Why would I need a will? Why would I need the power of attorney? But there are certain things that need to be made, decisions made about where a person will be living, if, what will happen to whatever assets they have. And sometimes people don't have assets now, but they might be inheriting them. There might be a lawsuit that's generated from something that happens to them, so there could be assets in the future. I always tell people you could win the lottery tomorrow, but we would be happy to meet with him and just talk to him about the options. And if he doesn't want to go forward, that's fine. Sounds like he might be burned by the legal system, so I don't know if it would be more harmful to him, but maybe talking to legal people who are listening to him might be comforting. I don't know.
Yeah, I think he would. He told me that he has had some friends that he made over the course of his lawsuit with lawyers, that he feels like he could talk to them, but they live in another state. So I think he would be interested in talking to somebody locally.
And did you see Danelle's comment about, did he say anything about SSI?
He did not mention that to me, but if he's not on it, I can definitely talk to him about that. Because I'm sure, I know that he has food, and so he has to be getting some kind of money somewhere. I just don't know where it is. I am going to talk to him right after this today, actually, though. So all of these recommendations will be helpful to tell him about.
Hi there, have you had a conversation about what matters most to him?
Yes. Yes.
I'm sorry if you did.
That's okay. I said it right at the beginning. So
I'm sorry, I missed it. I was in and out.
That's all right. He told me that what mattered most to him was trying to get some financial stability and kind of rebuild his assets after this legal matter happened and wiped out everything. Because when I asked him about why he came to therapy, he said he doesn't really know what he can get out of it at this point, since he is really only worried about like the financial stability part.
Thank you.
So I definitely will look into the SSI for him.
Is he looking for housing too, or is he okay in his housing?
I think he does want to look for housing eventually, because he is staying for free somewhere with a friend. And I'm sure that he seems like he doesn't want to burden his friend by staying there.
Okay.
He did tell me that is another social work student that referred him to Traeger. And he told me that she'd referred him because she said we could give him some kind of financial resources.
Did you say what kind of insurance he had?
I don't know. Let me see if I can look. He is on Medicaid.
Okay. So some of the Medicaid organizations have a variety of benefits for their members that may help with just a variety of things that you might want to consider. There's a list of those types of things that we can get to you if you don't have access to it, and you might be able to look at some of those things to assist him.
Okay.
Yeah, I just want to echo what Dr. Pam said. That's a really great resource for individuals as well, especially related to housing assistance. So figuring out which type, which Medicaid company his insurance is through, and giving them a call and investigating those resources as well. The other thing I wanted to say too is, because it seems like economic stability is a struggle for him, I'm assuming access to food is an issue as well. And so you might want to refer him to our food pantry at the Optimal Aging Clinic as well. That might be a good idea. And you can reach out to Jennifer Montgomery for that.
Okay. Let me see, I saw some chats pop up. I have not done anything with KIPTA, so I'll look into that. And I was trying to get him referred for CCM, but that I haven't gotten anybody yet for that. I think that all of his legal cases, like I think he's already paid for all of that, and it just left him with no money left. And he does not drive right now, and I think that's because he doesn't want to pay for gas. Oh, there goes my video. Okay. He walks everywhere or he takes the bus. But he said he enjoys walking, and he brings he always has a bag of dog biscuits with him, and he'll just pass them out to dogs that he passes along his route. So that's kind of like his self-care, I guess.
So I'm wondering if he's tried physical therapy or anything for his back pain. And
I don't know that.
I'm sorry, would physical therapy be available to someone on Medicaid, Shelby?
Yeah, absolutely. It would be, we would just, at our clinic specifically, we would just need a doctor's order, and all of the Fraser clinics are operating the same way. So we'd be happy to see him for even, I mean, if walking is his main source of transportation and it hurts his back, then that would be a really, really good thing for him. And we're right here in the clinic.
Okay, perfect.
Is he part of any community? Does he have social connections outside of the home he's living in? And
As far as I know, he's not involved in any groups, but he told me that there's people he meets around the community, like he has friends that he meets at a dog park, and like people that he's social with, and he goes to parties and like sees people regularly, but he just doesn't have anybody that he feels would be close enough for him to ask for support.
do you think he might be interested in the virtual friendly visitors program?
I can suggest it. I feel like he might just kind of laugh it off, but I'll definitely suggest it.
Okay. There was a question, is he a veteran?
He is not. Let's see if my camera's working again. So Justin, I don't remember, do you send the recommendations back to me?
Sam and I will
I
send
will,
them.
yeah, we'll send them.
Okay, because I forgot to take notes.
Okay, yeah, I've been capturing the key pieces.
Thank you. Oh, there goes my video. Okay, I'll just give up.
I understand how that goes. I think I came in and out of this particular Project Echo 3 times. Let me ask you this. Do you have access to the list of benefits for members of the different Medicaid managed care organizations? Because we can also put that with the recommendations that Sam's going to send you.
If it's on the Traeger Blackboard page, then yes, but
Yes, it is. It is on there.
Yes, then I do have it.
Yes, it's on that resource Excel spreadsheet. Okay. All righty. Any final comments or thoughts that anyone has?
I do want to point out, Joanna brought up a good point about the living will piece, and really, you know, I think helping people understand that a living will is really about what matters to them and who would make decisions for them if they couldn't speak for themselves. And, you know, I don't think it's ever a good thing to like really belabor a point with someone, but, you know, to really help someone understand that, you know, if the person they're living with found them unresponsive, you know, would that person know how to make decisions, and would they be able to make decisions for them? Because if the person isn't related, and I think Sheldon kind of pointed to this, and I kind of pointed to this last month, is that if someone isn't married and hasn't appointed or isn't related to them by blood, and they don't appoint them as a healthcare surrogate, the person can't make decisions for them in the state of Kentucky. So if they, have people that they're close to, or someone that they feel could be a good person to stand in on that, that's a really good opportunity for them to, maybe have them, in that living will, is somebody that might be a surrogate decision maker, because that's, it's not just about assets, it's really about what their values are, and making sure that those are acted out if possible, if they can't speak for themselves.
Yeah. All righty. I think on that note, I think we're going to transition. Thank you so much, Carrie, for presenting your case. And we hope that some of the recommendations today will be useful.
Thank you.
Thank you so much. And Sheldon, thank you so much for your presentation. Now at this time, we're going to transition over to the Kentucky Coalition for Healthy Communities. And I believe that Barbara Gordon is going to be talking through this meeting.
Sorry, I forgot to unmute myself.
We're all having fun with technology today.
Yeah. As long as we've been on Zoom since 2020, you think we would just know that, but I did forget to unmute myself and I was talking away. So hello again. Just want to share some information with you about KCHC. We talked about our mission earlier, and wanted to just talk to you a little bit about what's going on in your communities, and if you have any opportunities, etc. But as you can see here, our purpose is to train and empower stakeholders and community members to provide hope and education for their communities. You can go ahead, Justin. So we just want to take a little bit of time to share with each other about how meaningful this information that we received today is to us personally and professionally. Is this information that you believe can enhance your practice and your work with older adults in the community, or whatever population you're working with? And we also like to encourage each of you to share this information with your community. And if you don't mind sharing with us how you might do that. So what I'd love for you to do, if anybody wants to unmute and just share, teach back to us what you learned today, or you can even put it in the chat and I'll try to pay attention to the chat and read your chat. So what is it that really stood out to you today, and what did you learn?
I can share.
Thank you, Ava.
So I'm a master's student at the University of Louisville right now, but I actually, once I graduate, am hoping to attend law school, specifically to practice elder law and estate planning. So something that I'm really taking away today is just the importance of providing trauma-informed, culturally competent law services, especially when it comes to end of life and advanced care planning. Older adults are, in a very vulnerable state, especially when it comes to end of life and palliative care planning. So I think just making sure that all services, especially legal services, are, trauma informed and, maintain the inherent dignity and respect of the client themselves is really important.
Great. Thank you so much. Yes. And I'm excited about the fact that you're, as a master's prepared social worker, going on to become an attorney. That is something that occurs, I think, more often than what people know. So thank you for sharing that. The docs, I thought, this is from Micah, the docs that I thought had drafted to give my sister and best friend rights to make healthcare decisions for me might only be the ones that give her financial decision-making capabilities. So what this information, what this knowledge that you've acquired today have helped you to realize is that you need to double check. And you don't understand the different kinds of POAs. Well, that's a really good question. And if we have time, maybe our presenter can just give a really quick overview, brief overview of what the differences are.
Sorry, I was saying I didn't before today.
Oh, before today. So today it helped you to know the difference, and that's why you need to check. Thank you,
Yeah.
Micah. I really appreciate you clarifying that. And Dr. Yankee-Love says, it is time to review all of my documents to see if they are up to date. I'm walking away with that same thought, Dr. Yankee-Love. Well, Sarah, thank you. We'll be keeping those basic explanations of elder law documents to help me explain to others what they are and why they are important. Very good, because we do need to spread this knowledge. We need to share this information with others, with our colleagues, with family members, etc. There's several chats coming in, so I really appreciate your comments. End of life care is important to all, and it made me question why things like this aren't taught in a senior high school class or even a life readiness class in school or college. And you're absolutely right, Lily. And there are, believe it or not, there are national advocacy efforts to talk about end of life and even death more readily in our culture, in our communities. April 16th is, tell me the official name of that day, Justin. April 16th is the
National Healthcare Decisions Day.
Thank you. National Healthcare Decisions Day. And it's a national observation day where a number of groups, advocacy groups, including Traeger, we just make it our business to try to promote health decision thoughtfulness, being mindful of the different things that we need to do to be prepared in situations. The differentiation between the different types of wills and trusts was very helpful. Thank you, Jim. Heather, I also did not know the differences before today. So thank you all for sharing all of this feedback. And as I indicated earlier, hopefully we'll spread it, we'll share it. Chris says the first session was important and I'd be reaching out and setting up a lunch and learn event for my program. Thank you. Yes, that's what we want to know. We want to hear about what you might do with in your community with sharing and spreading this information. That's how Project Echoes are intended to provide knowledge and information and training to professionals and community members, and for us to take that information beyond our board, beyond this border of the Project Echo. Let's see, I think that's it. I think I got everybody. Oh, Micah, thank you. Also learning about the Special Needs Trust might be beneficial for my son in the future. I was going to help him apply for benefits once he turned 18, but didn't realize there were ways I could also leave him money directly. Yes, very, very good. We're so thankful for all of this wonderful information. If anyone's interested, this is from Dr. Yankee-Love, reach back to the Elderlaw Clinic at Traeger and definitely do that. Not only you reach back directly, but if you're working with individuals who you think are appropriate for the Elderlaw Clinic, definitely refer them. You can actually refer them through our website at the Traeger Institute website. You can do referrals within that website, or you can call the number that's provided. All right, so we can go on to the next slide, Justin. All right, so if anyone have any events going on in your community, anything that that you want to share at this time, healthcare, health fairs, training opportunities, etc., this is the opportunity for you to share with us any events going on. The Elderlaw Clinic information's in the chat. Thank you, Sheldon. You can capture that information. Any other opportunities that we might want to capitalize on that are going on in the community, even if you're not doing it yourself, but you may know of a health fair, for example. Many of our organizations do participate in health fairs that are going on. Louisville Metro Government RSVP and Alzheimer's Association. having an educational session on Alzheimer's and dementia, March 14th. Thank you. Is at the Thrive Center, right next door to Traeger. March 14th, 1 to 4, and that's in the chat also. Thank you, Chris. Okay, let's go on. So these are some things that are happening with the Traeger Institute. I just want to share with you and make sure you know about them so that you can share with the people that you serve and or family members, others that may be interested in these type of activities. My Health Matters, and so does yours. That is an education and support group meeting that occurs every Monday from 6:30 to 7:30. We have speakers to come in who provide good information and knowledge that really just helps us to continue our health journeys and manage any conditions or chronic conditions we may have. Flourishing Together is a health education intervention that it lasts 3 weeks. Is typically virtual, although we are doing some face-to-face and hybrid Flourishing Together interventions now. And participants learn easy and practical ways to eat healthier, become more active, and to take control of their health conditions. So it's really a good learning opportunity to help all of us to adopt healthier lifestyles and to prevent and manage diabetes, heart disease, and chronic disease. Our Flourish Care program is what we embrace at the Traeger Institute, and have a variety of services that helps to support the Flourish Care program. We also have a caregiver program in the virtual friendly visitor program, which I think it was you, Dr. Yankeelev, who referenced it today as something that might be beneficial for the case that we heard. Next slide. So these are dates for our upcoming Flourishing Together programs. Well, they've started, but the one that started this week, if you have anyone you think would benefit from the Flourishing Together program, although it started on February 14th, we do allow participants to come up through the second class. So if they register and came on February 21st, they can still get in this particular class. It is hybrid, so the person can come to the Traeger Institute at 2:30 on Tuesdays, or they can participate virtually, and they will learn more about that when they register for the class. Next slide. This is a schedule of topics that are coming up from My Health Matters. Our next topic is understanding healthcare, and actually one of our students, Beth Pace, who've been very, very active in helping to do a lot of our educational services, et cetera. She's going to be presenting that topic. You might note here on March 13th, Imagining a Gender Equal World, our very own executive director, Dr. Anna Fall. I don't know if you all saw that, but it has Dana Fall. We've given her a new name. Anyway, she's going to be presenting. So just make a note of that on your calendar. And another one of our students, Jim O'Neill, will be doing a class on March 27th. Addiction is real at any age. So I'm looking forward to all of these that are coming up. Just take note of the schedule, and you can also find this on our website. So if you want to share it with anyone, you can definitely find it on our website. Next slide. Yes, our Optimal Aging Conference is coming up. It'll be here before I know it. It's April 15th through the 18th. It is virtual this year. Again, if you scan that QR code, you can actually go to the site where you can look at registration opportunities, et cetera. Registration actually opened on February 15th, on Wednesday, February 15th. And early bird registration ends March 20th. So that early bird registration just gives you a lower registration fee. So just take note of that. And register as soon as you possibly can. We have a really robust conference with a number of presenters who are expert in their field in various aspects of the geriatric and gerontology field. So come and participate with us. Our theme is caring for mind, body, and soul. So as we age across the lifespan, and as we know, a lot of times when we think of aging, we only think of it after 65. And some people lower that number to 50 and all of that. But anyway, generally speaking, after 65, but we all know that aging begins at conception, and we're aging throughout our lifespan. And there's much that we can learn when we come to events like this, as well as take part and enjoy the networking opportunities. Next slide. So as we conclude today, this is February, and we are very honed in on compassionate care, and compassionate care does require the practice of love. When we love ourselves, each other, and everything around us, we won't want to destroy it. So that is just our saying for this month, as we continue on to serve the people that we serve, as well as take care of ourselves. So decide to be a vessel of love for your community. And if you decide to do that, then everything you do will be steeped in compassion and will have a lifelong impact on the people that you serve. In closing, you can read this for yourself. This is the KCHC pledge, just again emphasizing our vision and mission as it relates to the work that we do every day in our communities. And as you can see, we strive to empower our state to become a healthier and compassionate people. There's that word again, compassion. So with that, I thank you, and I give it back over to Dr. Yankee Love.
Thank you so much. We'll all be a vessel of love. I love that. Thank you, everyone. So we ask that you go on and complete the 1-minute evaluation. It should be showing up on your screen. Just a few questions to help us get a sense of how you're receiving our Project Echo. We thank Carrie and we thank Sheldon for all that you've shared with us today.